Yeah, we can just stand to the side. Okay. Right. Hello, everyone. Good afternoon. Happy Valentine's Day, Valentine's Day, Galentine's Day, all of the days. Welcome to today's Biome. We have a great speaker for you today. My name is Brandon Lewis. I'm a PhD student in YSE. I'm also a co-lead committee member for BIOMES. BIOMES is YSE's flagship seminar series where we invite speakers to talk about different environmental issues from all different sectors and walk of life. We invite amazing speakers who talk about their work and their ideas. If you've been enjoying the Biome series so far, we would like to welcome you to join the Biomes Committee, where you'll be able to give us input on who you would like to invite and see in the Biomes talks. And also you have the opportunity to meet and hang out with these great speakers. So it's a great networking opportunity. So if you're interested, we're looking for master's students, PhD students, postdoc students, you can join the train, definitely. You can reach out to me, Brandon Lewis, or Gabe Gatson if you're interested. So I'll introduce today's speaker, Dr. Ronita. Bardhan is an architectural engineer and urban studies educator with a PhD in urban engineering. Bardhan leads the research group, Cambridge Sustainable Design Group. Her research is centered around data-driven design of built environment for precision prevention from health and energy burdens in the warming climate. She triangulates building physics, engineering, machine learning, AI, and social data science to develop solutions for realizing health and low carbon energy built potential in built environments. Bardhan works on climate heat stress and health in built environments. She has extensively worked in slum rehabilitation, social housing in India, Indonesia, Ethiopia, Kenya, South Africa, and Brazil. Her impactful work has received traction from policymakers and have received wide coverage in news media. So let's give a warm welcome to Dr. Ronita.
I'll try to switch it on. Hello. So good afternoon, everyone, and thank you so much for inviting me to share my work. I am not very sure what is your academic background or discipline, so I'll try to make it as accessible as possible. So pardon me if you do not understand jargon or something of vocabulary that's very disciplinary specific. I would love to explain it and stop and pause and explain it. So today I'm going to talk about something which in the medical field people are very acquainted with, which is precision prevention. You have fever, you are not feeling well, you go to a doctor, the doctor precisely detects what's happening with you and probably would give you some medicine. And that's called precision prevention in the medical world. Today, I'm going to show you the potential of built environment as one of the precision prevention method, and also will bring up a context of what our future Earth would look like. So as Brandon mentioned, I lead the Cambridge Sustainable Design Group, and I work on these broad 4 verticals of sustainable development goals, which primarily deals with health, energy, mainly sustainable communities, but also a fraction of work is also on gender. I'm not a gender specialist, but I couldn't miss gender out of the whole work because it's so relevant, and you will see the connections. My primary work can be termed as data-driven design for built environments for precision prevention. What do I mean by that? I primarily work with lots of data in terms of how buildings behave, why buildings are made of certain things, and how they differ across the globe and yet contribute to a large amount of problem as well as solution. I also work with lots of qualitative data, which comes from human behavior, practices, cultural norms, and perceptions about primarily on health. And then I combine all of these together to respond to the current challenges of our world, which is spatial and energy efficiency and net zero carbon, and definitely occupant health and well-being. So with this background, I'd like to kind of give you a snapshot of what I'm going to talk about today. I couldn't miss out on connecting my work with Valentine's Day, which is such difficult because I'm speaking on Valentine's Day. But I didn't have any idea. So I asked ChatGPT, what is the connection between Valentine's Day and healthy built environments? And it kind of returned me this image. And I was like, I don't know what it means. But what I realized is built environments, for healthy built environments, it's about interconnecting people. It's about creating connections that enable people to live better. And that's probably what's love for all, equality across the world. And this probably can be connected quite loosely. And this image kind of gave me, this is what our built environment is. So it's majorly looked as a problem in this world. But imagine I show you pathways where we can flip this whole argument that built environments are the major problem, the way they are being designed today, and flip it into a solution such that they actually respond to the larger goals of sustainable development goals, as well as health and well-being in general, so that our future population can thrive. So given this background, what are the two greatest challenges we are facing? One is major global warming. We we can understand from our year to year how it is exceeding. But the second thing, which I'm going to focus a lot on, is on the global south, because that's where your future population or urbanites would be living. And there's this exodus of housing stock that is coming up, this built environment that is coming up in the LMICs, which brings me to the concept of such large built environments will have interconnections between energy, and that might have an interconnection to health. And how do we use feedback loops so that we can connect built environment for energy efficiency, for low carbon, while responding to the co-benefits on health? Given that I couldn't not use this image from IPCC, which kind of says, when I was growing up, I had a different world. When a kid who was born in 2020 or beyond, the world would be much different for them. For them, the health and well-being, equity versus equality would be different. It'll differ from where they are born in which part of the world. If they're in the global south, they're probably more vulnerable to major risks from climate, while also having co-risks to health. So given this, coming back to the whole question of how can we flip this whole carbon emissions? So last year, we emitted around this amount of carbon, of which this is the total amount of carbon emitted by the total building stock. And that they also contribute to around 1/5 of the total chronic diseases. This is a major problem. Can we reduce this? Can we walk towards a solution in the built environment space where all these equations kind of, or all these numbers kind of get reduced in a way that it also helps economies? Because currently, I'm using a statistics from the UK, where around 1.4 billion is spent just by the National Health Services in order to, because the quality of houses are poor. And this is one of the major challenges in the UK. So there's a lot of concern on upgrading the built environment to respond to good health. Given this whole construct, so I started looking at which part of built environment can be responded to in order to reduce the burdens to health. And then if you look at this whole interconnection that is being drawn here, that how different sorts of people live both indoors and outdoors, and how outdoors are built and indoors are built as a demand for housing, and they then, if these built environments do not respond to good health, then there is a problem of air quality, heat stress, and pollution in general, but they are also connected to major health outcomes. This kind of brings us that we might have to intervene in the built environment space in order to and built environment can be an upstream determinant of health. So in order to respond to the larger goals of health. And there's another thing that has come up in the mix because of the climate change is the major push towards decarbonization. So there are a lot of interventions that are being undertaken in the built environment space, and there isn't much evidence on what these retrofits or what these decarbonization strategies would have impact on health. So looking at co-benefits or co-risks of having different decarbonization strategies becomes one of the pathways to respond to built environments as a health intervention. So let's look at what are the global trends. By 2030, we are going to have nearly 30 million new housing units. Most of it will come up in the global south. Most of it will be in the affordable housing sector. This also means 1% increase in carbon dioxide will have a significant increase in the healthcare expenditure. That means without responding to it, countries really will need to figure out how to keep their population healthy. These are very broad statistics that kind of show that some of the trends are really going in the negative direction, which might be flipped by having interventions in the built environment. Given that we started looking at major cities and how cities have warmed up throughout the last 30 years, in the last 3 decades. And we found out that there has been a significant amount of cooling demand that has been induced in places which traditionally would not demand cooling. Given that 1 degree rise in set point can actually cost us 20% more energy, these sort of statistics tell us more about how much of heating or cooling, how much of mitigation of carbon emissions that comes from the built environment can have impact on not just energy, but also on other aspects that built environment impacts. Sorry. So I'm going to show you 2 broad outdoor versus indoor environment, both interventions, some problems, how to expand on those problems, and then how we can have some solutions around it. So this is in a typical global south city, you'll always find different archetypes of or characteristics of built environment. And these are 4 or 5 major archetypes. Some are very high rise, high dense, low rise, the low dense, or dispersed, compact. So given this is an example from Mumbai. What does the sectional view tells us? It kind of tells us how tall the built environment look like in the neighborhood, what would be the distance between the buildings. So we started trying to understand, there is a common consensus, cities are epicenters of heat islands, but where in the city are heat islands? Is there a way to design built environments so that we can flip this argument, so we can use it as an advantage? So we, instead of looking at heat island potential, we started looking at cooling potential of built environments, in the sense that how long would a built environment, particular combination of built environment where the blue, the water bodies, the green spaces, and the brown, the built up spaces, will be combined in such a way that they can actually have a higher cooling potential rather than having a lower cooling potential. So we installed sensors around the city. We got data around of 1 year of different seasons to generate this gray region of the graph, which tells us about the total temperature rise in that particular type of urban form, or the urban morphology. And whenever it comes down below the red line, we would assume that people would not switch to active cooling, given the current context of that city, where people are accustomed to a slight level of higher temperatures, and they would not exceed or accept any kind of active cooling there. So we found out that in one of the forms, which is this form, which is kind of high rise and yet high dense and yet not very compact, we found out the temperatures, this is annual average. So this the temperatures do go up higher to quite a high level of 40 to 45 degrees. However, it comes down very fast and it stays cooler. So whenever it is below the red line, it is cooler. it stays cooler for a longer duration. So it stays cooler from 6 o'clock in the evening to 10 o'clock in the morning, potentially when people would be using air conditioning unit due to heat island effects. Whereas if you look at another very drastic form, which is found across the global south, and it's the major people who would be shifting to the 300 million affordable housing units. And there we found out it doesn't rise up to a very large temperature, maybe 36, but it restores that heat for a longer time, and it's only cooler for a shorter duration. And this gave us an idea about how we can reconfigure morphologies in order to have more cooling potential in cities without having a lot of other sorts of intervention to cool down. But I'll also show you other sorts of intervention that we can use to cool down cities. And then we kind of reconfigure cities in a way that we have more cooling potential in the cities. So we actually, if we remember all the 5 different types of urban forms that we were showing, so we categorized them into different sorts of temperature, into their cooling potential, into a combined heat index. And we wanted to see what was the relative risk from heat of a certain typology of environment. Is there a characteristics associated to an urban form that will make it more vulnerable to heat, given that our climate warming is quite active? So we did find out that there was one form that had very low cooling potential, but very high heat index and relative risk to heat. And that was and that was this orange zone, that this sort of built environment. Just have this footprint in mind, because I'm going to come back to it slightly later. Most of the time, when we talk about cooling cities, we talk about green spaces, we talk about increase the large number of green spaces, the potential of planting trees across. So we did a systematic review. It is currently under review. So we did a systematic review to find out, are trees the ultimate panacea for cooling? And that told us that across the world, the cooling potential of trees are not equal. So they are not always cooling places, but because of high humidity in certain regions, the evapotranspiration can work the other way around, causing more heat stress. And we did find the range is quite high, and we found out that the cooling potential of cities can range from -4 degrees to around 4 degrees of cooling. And given that, so how do we design and configure cities with greenery being planned so that we can enhance that potential, just not through reconfiguration of the urban forms, but also including the green spaces? So we started looking at different cooling strategies that are currently available for policymakers to adapt for their cities. And in order to do that, what we did was we did a co-creation strategy. That is, we actually spoke to a lot of stakeholders across these different cities, and we gave them these solutions. We developed something called a matrix of ITE, which is a combination of investment, time, and effectiveness. So effectiveness of cooling was our job. We found out what is the effectiveness of cooling of different green environmental strategies, and investment and time was a part of what policymakers told us. So how much investment they are ready to make or agreeing to make, and what is the time required, that came from the most of the industry partners. And we combined them and developed a matrix to find out what is the effectiveness across different cooling strategies across different climate zones. So if you have a certain local climate zone, say LCZ1, which is most of compact high rise, and if you combine, so M is the total number of strategies. So we had 8 strategies in the previous slide. So if you combine all of these strategies, what is the total cooling potential for different sorts of climate? Often we found out that if you combine 3 strategies together and not just stick to one strategy, that becomes much more effective in cooling down. But we also had to combine that with what the policymakers liked. So in the previous slide, we could find out the policymakers really like this urban forestry, which is not available for lots of cities that are already built. And the second one they like is nothing to do with urban planning, but they like indoor environments to be modified in a way that they can cool the outdoor environment. So these sort of, so effective indoor cooling and urban forestry was the most preferred. So after that, we gave all these policymakers a matrix, which this is an example from LCZ1, a matrix which kind of told us what is the total effectiveness versus what is the total of investment and time required. So now they can choose between number of interventions that they would like to go to in order to cool their cities down, or also they will have the potential as a matrix in their portfolio to choose from. So this is the work we did with the policymakers and to respond to the outdoor environment. I wanted to keep it short, but there is a lot of work that we are doing on the outdoor environment with policymakers to cool down not just global south cities, but also UK, which has very high green percentage and yet struggling during the hot summer days to cool down. And there's a rise of purchase of air conditioning units, which has never been in the past in the UK. So when we talk about indoor, one of the things that comes up drastically is indoor air pollution, and it's linked to non-communicable diseases. And so it was evident. I've worked quite a lot in the global south, both in Africa and India, on indoor air pollution, and it's linked to the choice of energy fuel. And it's evident that it is one of the largest burden of disease that the world can face, particularly concentrated in the global south, to the extent that the number of dialyses are quite large and concentrated in a certain area of the world. Given that, we started looking at primarily global south in terms of what is the connotation or meaning of indoor air pollution. So this is an image that you will typically find in a rural India or even in rural African cities, where women would cook in a dirty fuel with an infant in their lap. That means a cold start of a dirty fuel cook stove releases around a massive 50,000, that's a cold start, 50,000 microgram per meter cube of particulate matter, but then it slowly goes down. And we monitored kitchens that actually are using dirty fuel. And secondly, we also found out that on an average in the global south, people are more exposed to indoor air pollution and are more at risk from indoor air pollution than outdoor air pollution. However, thresholds for relative risk for different designs are still yet to be, it's still a nascent stage of research, which we are trying to do. How can we connect design elements with indoor air pollution relative risk? And I just wanted to share this graph, which has come out in 2023 out of the Imperial College's BOLD study, where they looked at the lung size of their cohorts in these sort of countries, and they've significantly found that there is a shrinkage of lung size in population that are in the LMIC countries. And this nearly majority of the lung capacity is reduced. That means moving forward, major population will not be living healthily. Given that, I'll show you a case from Kenya where we are currently working. This is an ongoing project where the Kenyan government have done massive interventions in terms of reducing vector-borne diseases, which is reducing the mosquitoes' entry into the houses. So they did a massive intervention in the past decades to make these houses, give interventions that will make these houses mosquito-free. But in this whole process, what they have done is, earlier, women used to cook outside, or the primary person who cooks would cook outside, given that there is a cultural notion that people generally cook outside in that community. But because of the intervention of the mosquito repellent coils or mosquito repellent meshes, these houses have modified their cooking behavior. Now they have brought in the cooking with dirty fuel, whatever access they have, inside their home. So what now, after 10 years, what they are currently facing is a coupled risk from not just vector-borne diseases, but also from heat stress and indoor air pollution, to the extent that we modeled and monitored nearly 100 houses in one of the villages in Kisumu in Kenya, where we generated different, I'll just show you the magnitude here. We found out nearly the indoor temperatures can go up as high as 46 degrees on a normal summer day, and it doesn't need to be a climate change or extreme heat wave day to reach these temperatures. Apart from that, we then modeled the coupled risk of vector-borne disease with heat stress disease. And we found out it's not about if you're cooking in 2 stoves or if you have more number of windows that will actually relieve you from the coupled risks. It can, so we did have quite a large number of population which had lesser, like 1 cook stove, but had just 1 window or even 2 windows if they had. So generally it's 1 window. This sort of, they had a very high risk from vector-borne disease. And you see there are two graphs which shows about the closed roof eaves. This is when the mosquito repellent meshes were installed, they often closed a large number of eaves in the houses. So there was, and some of they are still closed, and some of them they are ripped off, so they were never maintained and people never uptook it and replaced it. So now they are now closed, they are now open eaves. But the risks remain nearly similar for both the closed and the open eaved houses. So bringing the same context to India, we started looking at, in rural India, we did a survey about what, if we cannot one of the major solutions to warding off household air pollution or reducing housing air pollution is on making people switch to improved cook stove or cleaner cook stove or cleaner fuel. But we all know how it hasn't been picked up in major economies in the global south, although now there are quite a large number of programs that are being launched. So we started looking at 2 different things. One is, can we change the behavioral intervention in terms of, can we do an intervention that can reduce their cooking times? Or can we do a built environment intervention so that even if they cook with dirty fuel, even if they cook for the same amount of time, which is akin to their cultural practices, will that enable them to escape the household air pollution? So in order to do this, we did a survey of one village near Maharashtra, which suffers from very high level of household air pollution, not just because of dirty fuel, but also the way the kitchens are made. So this is where the socio-cultural practices came in, and it was quite a surprise for us. If you look at the houses of these sort of, the kitchens that you're actually seeing, they are very well made. They have tiled floor, they have air conditioned units in the living room. But and the kitchen is never attached to the living space. The kitchen is always separate, and it's always outside, as well as the toilet. And the kitchen is nearly used 8 to 10 hours by a woman. And if that's a young mother, will have the children in the same space. And it's often dark. I don't know if you can guess why the kitchens are so dark. Anyone? It's not access to electricity. They all have electricity access. It's because it was a revelation for us. So we asked all the women that, why don't you put on a light when you're cooking? And first of all, these houses are all single storied. That means anybody who passes through near their house, they can actually see through the window. So they will always, so you'll see in most of the cases, they actually close the window. They will close this window when they cook. This is for a privacy reason. They don't want themselves to be visible. They don't want strangers to look at their food. Secondly, why it is dark? They said when they cook primarily in dark, because when somebody from outside comes inside this kitchen and the women are not properly dressed, the time it takes to adjust the eye to that darkness of the other person, it gives the woman the time to adjust their clothing to meet the social norms. And that's why they do not choose to light up these spaces even during when they are actively cooking. So this does have multiple connotations. They do suffer from poor eyesight, which is quite known now in the rural India, specifically young women. Also, because they close their window, their indoor air pollution is quite high. So we modeled all the kitchens in that village. It had 157 households. We modeled all the configurations. So we had a huge batch of kitchen design. And what we did was we tried to see the worst kitchen versus the best kitchen. So there was one kitchen which was like a long corridor sort of a thing, very dark, and the woman was cooking at one end. And there was one kitchen which was decently designed. So we used a concept called age of air, which basically means imagine a packet of air enters, circulates through the room, and leaves the room. So how long does that take for that packet of air? So this is the conceptual metric where we found out that the poorest kitchen actually took 3.5 minutes. Now, if you convert this into air exchange rates, it will basically mean it will take one exchange to happen, it will take 2.5 hours. Whereas a healthy kitchen should actually have 3 to more exchange rates per hour. So we seize this and we say, can we make a design intervention so that these kitchens do not take such long to clean themselves, self-cleaning kitchen. We don't call it that, we call it efficient kitchen. So we designed a kitchen where we took into consideration not the engineering part of removing pollutants, but also the socio-cultural parts. So even if we provided a window just above the stove, which you can see here in the image, and we assumed during our modeling phase that it will be closed. However, we provided a long mesh on the quite high up, above the eye level, so that the air can actually escape from there. So, and then we modeled the kitchen there, and we found out that the age of air was reduced from 3.5 minutes to around 35 seconds. And we took this to the local, they call district magistrates, and we showed them these results in the hope that there would be some governmental intervention. But in the whole process, we found out it's actually very easy to implement this, because every year during the fresh harvest season, everybody remodels their kitchen. So there's only 1 or 2 masons who would be doing or rebuilding the kitchen. If we actually train those masons through governmental and community support, most of the houses, it is not too many houses, just 157 households, they can actually have a much more cleaner kitchen without shifting their cultural practices, maintaining their cultural social norms. Now let's look at, this was rural indoor environment, both from Kenya as well as in India. Now let's look at urban indoor environment and why that is important. And I'm going to mostly talk about affordable housing because that's where the investments are minimal, and yet you will have a larger population living there. So we started from Bhutan, and we looked at 13-year-long survey data about, because Bhutan places happiness of their or well-being of their population to the highest level, and they do it across all their policies. So they had a living standard survey done. So we looked at that, and we wanted to see, is there an evidence that if you live in a certain type of built environment, you will have higher risk to health from different, or you are spending more. Mind it, in Bhutan, you don't spend any healthcare expenditure out of pocket. Everything is taken. So any hospital visit is taken care by the government. You go for any kind of medical intervention is taken care by the government. But there is also a larger cohort of practice or spending in healthcare in alternative medicine, which is not taken care by the government. So all these expenditures that you will see throughout in the next 2 slides is about the total expenditure. So combining alternative medicine or local traditional medicines and hospital visits. And we did find out, so whenever the healthcare expenditure went up, so we did it for cleaning, cooking fuel, then we did it for different types of windows, we did it for rooms, we had it for all sorts of building design elements like windows, roofs, wall type, floor type, roof type, source of drinking water. And we often found out, and we did a kind of a propensity analysis to find out that housing with permanent floors spend nearly 90 times less than housing with a mud floor. And this is in Bhutan, mud floor is also a choice. So you can actually ask the government to give you a mud floor because that's what they like to live in. So housing that uses clean fuel spends 130 times less in healthcare than housing using dirty fuel. More windows in houses had negative correlation to health expenditure, and which is kind of understandable. However, this one was very interesting. Hospital expenditure was higher for people with tile floor, permanent roof, more number of rooms. That means the do nothing scenario is still very high in a country which supports healthcare. And this hospital expenditure kind of tells us that only higher income population living in much more better environment still fall sick, but their expenditures are higher because they take care of their health much more, or more concerned about their health. This brings me back to India. And if you remember, I showed you one of the form that was of very high heat stress. And why, and which form is that? So across the global south, this phenomena is going on where all the slums, which I don't really like to use that word, all the informal settlements are being replaced by affordable housing, something like what I show in the image. And these housing are built how? So let's look at the policy, what they are doing. So a normal national building code for any of these countries in Africa or in India would follow something called a 45-degree rule. That means the distance between the buildings will have to be in a proportion to the height. And I think this is across UK, this is across US. We all follow this sort of a norm. It might not be 45 degree, it might be a little bit more steeper, but this is a norm that 1:1 ratio should be followed. For very high-rise buildings, the norm can be kind of compromised to a much more steeper slope so that it's around 1:2 ratio. However, when you look at the policy, and this policy document that I'm talking about is both for Indian affordable housing, Ethiopian affordable housing, Kenyan affordable housing, and Rwandan affordable housing. So if you read the policy document, they say this line is common in across all the documents. So we don't know where this all started or who copied from whom. It doesn't say any kind of proportion. It just says the minimum distance between the buildings has to be 3 meters. Now, when you give a developer a compliance with a minimum threshold, you will only get minimum threshold. There is no way you're going to get something more lavish. So this is actually happening across the global south. This is an image from Mumbai, not taken by me, from a movie, where this is a very metaphorical image where we can see that these slums are being replaced by these very high-rise buildings. And this is not a very typical phenomena for Mumbai. It's happening across the global south. And it's so much so that in Mumbai, nearly 50 to 55% of population lives in informal or informal-like settlements. So they are actually the beneficiaries of who are going to live in these high rises. So you can find these high rises coming up across the city. And this comes up through a policy which is called slum rehabilitation policy. And when we surveyed all the types of houses that have come up, and they started around 1990, most of the houses came around 2000, and people started shifting around 2010. After getting through the whole process of the government. And this is a very win-win policy for the government because the government doesn't intervene at all. The developer identifies, so how does this whole policy works? The slum population will go to the developer and say, we want to participate in the slum rehabilitation housing policy. The developer will then take this 70% consensus from that community and go to the government and say, these people want to want to participate in this policy. What does the developer get? So developers' only obligation is to build this building. And the rest of the land that will be freed from building these houses will go to the developer free of cost, free of tax, and the developer doesn't pay a penny. Only obligation is they have to build these houses for free to accommodate the whole neighborhood. And so we found out these are the 3 different designs. Just remember the type. One is X type, which is you have the corridor and you have units all along the arms. And then the I type, which is like a double-loaded corridor, like a hotel design or a hostel design. And a single-loaded corridor, that means the corridor runs through the periphery of the unit. And we got very interested into it. This is primarily because it has energy consequences. It also has, that means the energy consumption can go up and go down, or it can actually have higher heat stress potential. And this was the form that had the highest risk from heat stress. So we looked at the 3 different designs that were being used. That means, so people who used to live in this sort of, this is from a slum. This is called Dharavi slum, which is the famous slum in Mumbai. It's also one of the Asia's largest slum. And they will be living in this sort of public space. And I'll not talk about it. I'll probably talk about it later, what this difference in public space means. But we also looked at windows, which are primary channels and outlets controls for thermal comfort and ventilation. And this is what the current rehabilitation housing windows look like. Given that we actually rented an apartment unit, we set it up as a live test bed, while we also monitored more than 50 houses in that neighborhood in order to get what the live data is when they are cooking in terms of pollution. But we also did a lot of parametric experimentation on these sort of houses, like we closed all the doors and windows and then started cooking and saw when does it come down in terms of air pollution concentration. We did different sorts of design combinations to see what is it that can actually make these houses better even after they are built. So after we did that experiment, while we also conducted a survey, and our survey was very simple. We asked them, how many times did you visit the doctor in the last 3 months, and compare it to when you were living in the slum. So most of the people said that if in the slum, typical household size is around 5.5, which is around 6 members. So 6 member would go, every member would go once a month or once in 3 months. Now every member is going once a month to a healthcare, doing a healthcare seeking behavior for some sort of illness or ill-being. And this is very concerning for a country like India, where do nothing scenario is the highest. That means unless people feel they're going to die, they don't go to a doctor. And this is embedded in a culture. It is irrespective of even socioeconomics. So if you're in a higher socioeconomic scale, you might still behave in the similar fashion. So we did find there's a large proportion of population who are actually going to see doctors regularly. And this is primarily for prevention. We also wanted to see, is this burden of living in these sort of houses is asymmetrically distributed? So we started looking at age of air and the floor that they were living in. We found out there was a significant proportion of population that were living in the ground floor were making larger number of visits. So the frequency of visits were higher for people living in the ground floor versus people who are living in the higher floors. And with every addition of floor, the relative risk of living in those floors increased by nearly 1.5 times. And this kind of brought us to something that was ongoing. It was a project that was ongoing for the government. So the government of India has one policy, which is housing for all, through which these houses are being built. They have another policy that is eradicate tuberculosis by 2025. And they came back to me because I showed them lots of energy simulation and said, you're actually not counting for the total amount of energy burden these houses are going to face. And they said that they are facing a large amount of population who are reporting tuberculosis after they have shifted into these houses. And this is concerning because when you have a vision to eradicate tuberculosis by 2025, and you want to build all of these houses within a certain threshold, if there is a correlation, so they asked us to do that. So what we from day one knew there's a very strong correlation. So we ran all these environmental analysis. So I'll show you very brief graphs for this, graphics for this. So in the X type, whenever you see, this is the daylight analysis. So whenever you see red, that means there's active daylight falling, and not just an active daylight falling on those units. So those units have, for nearly 80% of the total daylight hours, they will have sunlight and daylight inside their house. Whenever you see blue, that means there is absolutely no daylight that these units are receiving. So now you can see how it kind of differs when it is a double loaded corridor. At least the rooms are receiving some based on if they're in the leeward or windward side. And also and if you look at this one, this was quite abysmally bad because only the corridors receive daylight. The units don't receive daylight. And tuberculosis is a bacterium. I'm not an expert in it, but I have known that tuberculosis bacterium can be made inactive by UV radiation. And so if you have longer hours of UV radiation, you will have larger probability of having lesser amount of risk from tuberculosis. We also did air velocity, and we found out generally in order to have a healthier air, you need around 1 meters per second, 0.8 to 1 meter per second of air velocity within the units. Only the X type had that. The I and the H type had quite low, like 0 to 0.3. And then we looked at just the data of people who got tuberculosis in these communities. So each of these X type, I type, and H type represent around 5,000 to around 5,000 households each. So this is quite a significant number, and this is from the dot center data, where we found out there was a high proportion of population that were reporting tuberculosis. So there was a prevalence of tuberculosis in the I and the H type, whereas in the X type there was low. Our interest was to find out whether these population who are reporting tuberculosis are people who got the tuberculosis when they were in the slums and when they shifted their reporting, or is it something else, or did they develop it significantly after living in these areas? So we did find that for the I and H type, after people lived around for 4 to 6 years, they started reporting tuberculosis, whereas in the X type, they reported tuberculosis within 6 months to 1 year. So there is definitely a correlation between how buildings are designed to the total incidence of tuberculosis, or prevalence of tuberculosis. We also said that they will face a large population of women and children having tuberculosis in 2020. And this is not a global average. Globally, it is mainly tuberculosis is a male disease, and it comes mostly larger proportion of male population get this disease. In Mumbai in 2021, it was reported that there was an increase of 7% on females reporting tuberculosis, primarily living in these sort of areas. So coming back to the pollution level, we also found out that on most of the time, people, because of in the H type, because the corridor is actually a public thoroughfare and access corridor, people keep their windows closed while cooking. And that's where you would get something. So if you look at these graphics, so whenever this is there, that means the window is open, and this is a window closed. If there's a ceiling fan on when they are cooking, and if a blanket hung, means that deposition of particulate matter is happening at a higher level because they have lots of furnitures inside. And we found out on an average, people follow this, which is windows closed and the fan on. So somehow there is this whole process that if you switch on the fan, the smoke and the particulate matter will go away, and the concentration will be lower, which is not really the case. And so in order to look at interventions, built environment interventions, which combines both passive as well as active interventions and behavioral mechanisms, we said just by doing behavioral mechanisms like opening the windows, you can actually reduce it to a significant level, but it will be still higher than the ambient. But by using a HEPA filter on the windows or planter beds and HEPA filter combination of them together, you can reduce it by 94% with active as well as passive measures. But if you don't do anything, if you just install an extract fan, it actually can reduce to a significant level. However, extract fans were not being given by the government or the developer at that point in time to the dwellers, so they were not installing it. Coming to my last portion of the slide, so we started looking at heat stress, and we found out an interesting data. This is where the gender came in. While male population were at heat stress at a much more lower temperature threshold, the female population said they are more comfortable at a much more higher threshold. This means that the female population would reach for adaptation much later when physiologically their body has gone under stress. And this is a major thing, which this data doesn't exist in a larger number. We couldn't find any data set which actually could give us this sort of a indicator to understand the relative risks between male and female, but we did experiments in mice, one of my colleagues from Cambridge, to see if male mice versus female mice has higher potential from heat stress risk. because, and they did find out in mice, there is a higher immunological risk from heat stress because female mice were tolerating higher risk of heat and were going into an immunological compromised condition, whereas male population had a much lower threshold of heat risk. And we are still working on it. I don't have lots of data on it. So we looked at this, if active cooling is not the way forward, because that's where the total carbon emissions come from, then let's look at what is the gender, how can we do it? So this is a very interesting image. So you see certain numbers written at the bottom of each of these images. So this kind of tells us, if you turn your jackets, if you're carrying, there's a number written in your jacket. And that tells you how much insulation property that jacket has. That means if you're very cold, go for 90%, 80% insulation. If you're very, so a typical winter clothing in this sort of weather, you would go for a clothing insulation of 0.8 to 0.9. And this experiment was done on a hot summer day. And when we looked at all the women, their clothing insulation were nearly at a range of a winter clothing. And this is because you can say they're all wearing traditional clothes. And this is primarily because with modernization, traditionally clothes were made of cotton, which allowed for ventilation, which allowed for cooling themselves down. So traditional clothes are not the problem. It is the material, because all of these material is synthetic, that is causing this high level of insulation. And now imagine this is coupled with the heat stress of higher threshold that women are bearing. So this coupled with higher threshold and having less agency to actually access cooling information can put whole population into a high level of heat stress. So this is our latest work where we did find out, while the total all-cause mortality has a very similar trend for both males and females, but when we just looked at temperature-related mortality, while the females are actually showing an upper trend, the males are showing a different, an opposite trend. And there isn't data, so I do say there is a lot of data can be generated in this space, and there isn't any data around this. This brings me to the whole end of my talk, where I talk about that we can do a lot about population health, but if you look at individual built environment interventions, we can also apportion the burden to individual risks of health. And this can be done by doing a value-based reimbursement approach versus a cost of illness approach. Ending my talk here into the conclusion. So in order to summarize all of this, how do we kind of respond? So we can respond by recognizing the problem, calculating the health and the climate burden, grounding them into the interlinked SDGs and in culture. Then people-centered approach becomes much more important. So when you recognize through the people-centered approach. When you reflect, making risk information more tangible. So when we made the women available the data that at what temperature they are actually reporting neutrality or thermal neutrality, they were themselves surprised that they have such high tolerance to heat. So it makes people more powerful, informing policy through evidence, and then finally transferring the agency and generating new data. So I do lay a lot of emphasis. There isn't gender data available in order to map heat stress risks from indoor and outdoor environment. A lot can be done, and built environment, if done right, can be both a climate and a health action. And if nothing else works, we all should pray. Thank you so much.
Okay, we'd like to thank Dr. Ronita Bardhan for the great talk today. Unfortunately, we don't have time for questions. If you are going to BIOMES lunch, you can meet us on the second floor. And thank you so much for joining us. Oh, meet us on the third floor for the BIOMES lunch.